Hi, I'm Nikki, and I'm an outreach worker with the UFO Project. This video is for use with the UFO Model Education and Support Group. We're going to start with a brief overview for group facilitators, and the rest of the video should be shown to participants at the beginning of the group. Before the group, you and your co-facilitator should read through the entire section of the UFO Model Replication Manual. The manual will give more in-depth content than what is covered in this video. This session can bring up lots of questions for participants, and sometimes these questions can be obscure. Don't be afraid to say you don't know and get the answer to them later. Also, be sure to have a whiteboard or a pad of paper so you can keep track of these questions.
Hi, I'm Alice, and I'm the clinical nurse specialist with the UFO Project. Today we're going to talk about body and mind, how alcohol, drugs, and Hep C affect your physical and mental health. We'll start with the liver because alcohol, drugs, and Hep C affect your liver more than any other organ in your body. Did you know that the liver is one of the most hardworking and important organs in your body with over 800 functions? It's like the super filter or housekeeper for your body. Alcohol, drugs, and Hep C can all cause scarring in the liver, called fibrosis, making it harder to do its job. Eventually, the scarring can become so severe that the liver shrinks and hardens, called cirrhosis, and can't function at all. Alcohol, heroin, coke, speed, pills, pot, and tobacco are all toxins that the liver must process. The more pressure you put on the liver by overusing these substances, the harder your liver has to work. Alcohol has the biggest impact on the liver and speeds up liver damage more than any other toxin. The best thing you can do for your liver is to stop drinking or using drugs. Remember that everything that goes into your body, from the air you breathe to the foods you eat to the medications you ingest, has to be processed by your liver. If you don't want to quit, there are still lots of things you can do to improve your liver health or at least decrease the negative impact using has on your liver.
Drink or use less at one time. Wait as long as possible in between each shot or each drink to help your liver process it. Also, drink water between each shot and each drink, which can help your liver process fewer toxins at a time, and can also help slow the development of scar tissue.
Eat as healthy as possible. Eating a healthy, protein-based diet can help your liver stay strong and healthy.
Drink water. If you use a lot of drugs and drink a lot of alcohol, water can help flush toxins out of your body and keep you hydrated.
Sleep. Getting enough sleep is also important. Eastern medicine tells us that between 1 a.m. and 3 a.m. is liver time, which means if you're asleep, your liver will get a chance to rest and recharge itself.
Now we're going to switch gears for a little bit and talk about mental health. One of the goals of this session is to discuss ways to better take care of yourself, and dealing with your mental health is an important part of it.
It's common for people to use drugs to deal with their untreated mental health issues. A lot of people who hear voices, feel sad, anxious, depressed, or have other psychological symptoms use drugs as a way to cover up or deal with their problems.
Sometimes mental illness can increase the likelihood that someone gets Hep C or transmits it to others. Depression can cause people not to take care of themselves. Other disease states like schizophrenia or mania can cause people to take risks that they otherwise might not.
People who struggle with mental health issues and use drugs are up to 10 times more likely to be infected with Hep C. People with mental illness are less likely to seek and access medical care, and therefore don't know what their Hep C status is.
Most people experience some form of mental distress in their lives. It can be very scary and make you feel alone. There are many ways to help improve your mental health. Ask your facilitator about what's available in your community.
At support groups, you can meet other people who've shared your experiences. It's a good way to find out who's a good care provider, what medications have worked for people, and other resources that people have found helpful.
If you're feeling anxious, depressed, hearing voices, or having hallucinations, you should talk to someone about it. Sometimes having a supportive listener can do wonders. Friends, family, nurses, outreach workers, and caseworkers can be a resource for you.
The next step is to try to deal with the problem. Therapists, social workers, psychiatrists, and acupuncturists can be great resources to help improve your mental health.
Most mental illness is caused by actual chemical imbalances in your brain. Sometimes, no matter how hard you try, you cannot change what's going on in your head, and medication at times is necessary to change that, to hit the reset button. Lots of people use drugs as a form of self-medication. Does this sound at all familiar? It may, and if it does, remember that medications you get from a doctor can be safer, more effective, have better dosing, and are legal.
Do mental health issues give you Hep C?
No, but people who have mental health issues are often at more risk for Hep C. You might not care, and you might not make the best decisions when you're struggling with mental illness.
I know I'm depressed and I should see somebody, but I don't want to take any meds.
No one can make you take meds. Don't let fear of meds keep you from seeing someone and getting help. Good mental health care is hard to find, but there are resources available. Ask your facilitator for referrals, and don't forget to use the internet to find resources in your area.
My liver hurts. Do I have Hep C?
The only way to know if you have Hep C is to get tested. Some people report flu-like symptoms when they first get infected, but the majority of people are asymptomatic. That is, they have no symptoms for as long as 30 years.
I had a lot of problems with seeing and hearing stuff that wasn't there, and it would in turn, make me really anxious or have some kind of psychotic episodes and stuff. I medicate until I don't feel crummy anymore with whatever I might happen to have around, any kind of mood or mind-altering substance that will take me away from the feeling that I'm feeling now when I get to that point. So, other than that, I don't really take any medication or anything. It's just I've been having mental problems for so long, I just kind of cope with it on a daily basis anymore.
For more information, please visit our website at www.ufomodel.org. And for any questions, please contact us via phone or email.
Thanks for watching, and stay safe.